indices of social development, and this is something that Irena and her colleagues have been working on for about 12 years. I think it's an underused resource at ISS, or perhaps maybe worldwide a lot of other people are using it, but at ISS it's an underused resource. So if you're looking for research topics, research papers, these data can be combined with other data to do some interesting cross-country work, because it has data, I think, on 6 dimensions for all the countries in the world, perhaps, and it's updated every 5 years. So if you're looking for a topic, and that's sort of something to look into these data. I think there's a prize also, if I'm not mistaken, if you use these data. So perhaps if you're really interested in the prize and the 500 euros maybe, or whatever the sum is. 250, sorry, yes. We might increase it then to match the other prize. So that's sort of a way to encourage people to use these data. But at ISS, we have not just these data, we have other indices as well. There's a Kids' Right Index. I don't know whether you all know about the Kids' Right Index. And I think the idea is that as we go along, ISS would develop a data repository with data from your master's theses, if you're willing to do so, from PhD theses as well. There's an Erasmus data repository. And the idea is that in the future, you can sort of have access to a large number of data sets with your permission if you want to use it. This is certainly a pioneer in that sense. As I said, I don't think this has been used very much, but I hope that now with both of you having updated this, it will be used a lot more. Having said that, I'll hand over to Irena to carry on with the presentation to give you an idea of what data there is and hopefully encourage some of you to, well, use these data, right? Okay.
This event is the ISD 2020 data launch event. As Arjun already indicated, we collect, calculate and present data every 5 years. The reason why we don't do this every year is because social level data, data for society as a whole, they don't change from year to year. They change very gradually. Think about the data for social cohesion, which we have used in a paper that Jimena will present later today. Social cohesion doesn't change suddenly from one year to another because it's largely determined by cultural and social factors in society. Of course, we do see changes, and that is why we present here trends between 2015 and 2020. If you're interested, you can go to the website. All the data is freely available. You don't need to register. You don't need to pay. You can simply download, and then you can even go back to 1990. So with this data update 2020, we have data available for a 20-year period. Now the team, of course, important to mention, Sanchita Bakshi, she's online, Jimena Pacheco Miranda, and myself. Then I need the mouse to go to the next one. So a year ago, before updating the data, while we were working very hard on updating the data, we created, together with an ICT team at Erasmus University in Rotterdam, a new website. It has some new features. It has a more accessible look and feel. We have updated all relevant information. For example, after this session, we will upload, if you agree, a recording of this event. So then you can look it up and check for information. Also, a new feature is that the data download tab is now more accessible. The default is that you only get the indices, we have 6, with their standard errors, but not all the underlying indicators, because for some indices we have over 30 indicators, and you know, if you download all 6 indices and all these indicators, you have a huge Excel sheet, and you may get lost in it if you're not used to work with so much data. So the default is simply the 6 indices. The indices are here on the screen: civic activism, clubs and associations, intergroup cohesion, interpersonal safety and trust, gender equality, and the inclusion of minorities. Now, the use of the data, we also included now on the website a list, which we will update every year, with publications done by third parties, often without us knowing, because, as I said, the data is freely available online all over the world, so researchers find our database, download our data, and do their own research and get it published. So just for your information, particularly those who might want to use the data and have no idea yet what kind of topic to study with this data, you get some ideas of this list of publications over the past few years. And also our download statistics show that researchers all over the world are using the database, and indeed more researchers in the Global South as compared to the Global North. So that's quite interesting. We also have a new hosting, so now it is hosted actually by ISS. So with this click, you see we access the website, and those of you familiar with the building will recognize this photo at the top. You simply click on any of the 6 indices that you find interesting, and here we show a table with all the indicators, the variable names that show on the download sheet, the source, and the number of countries per indicator. So some indicators have only very few countries, others have high numbers of countries. Okay, now I need to go back to my slides. How do I do that? You are screen sharing. I know I'm screen sharing. Tab? Escape. Nope. Nope. Tab? No, please. Thank you. Okay, so this is about the new website. I hope you like it. Now the 2020 indices. We put a lot of work, time, effort in finding as many indicators for each index as possible. And the result is that we have indeed more indicators than before. So worldwide, more data has become available. Of course, some data sources that we used in 2015 or earlier years, these data sources discontinued, so we had to replace some of the older variables. And sometimes we had to look for new variables that did not exist before, that nicely fit into one of the indices. So on the whole, we have more indicators and more data, and as a consequence, more countries included per index. So this is an overview of the 2020 indices. So for civic activism, we include 14 indicators and have 104 countries included, and this is actually the lowest number of countries. So clubs and associations, we have 112 countries, and we have 26 indicators. Intergroup cohesion is a bit smaller, 9 indicators, but 161 countries, that's a lot. Also for interpersonal safety and trust, we have 160 countries, quite a lot of indicators. Gender equality index, that's the champion. We include almost 30 indicators, and about, 192 countries are included in the gender equality index. And it makes a very good competitor for other cross-country gender indices like the Gender Inequality Index of the Human Development Reports, or the Gender Equality Index of the World Economic Forum, for example. Finally, inclusion of minorities, 22 indicators and 155 countries. So you see that the country numbers are quite high, and particularly those over 160 include a lot of developing countries. Now, finally, I would like to give you an indication of changes in the average score of countries on each index. So for inclusion of minorities, the average in 2020 is 0.47. They're all on a scale between 0 and 1. Whereas in 2015, it had a slightly smaller score. Same for gender equality, that remained the same, so no changes. For intergroup cohesion, we see an increase. Again, 2 percentage points. Interpersonal safety and trust, 2 percentage points increase. Clubs and associations showed a small decrease, and also civic activism showed a small decrease. So here is the data themselves already suggest topics for a research paper. Why was there a decrease in, for example, civic activism between 2015 and 2020? How can we explain such a decrease? And you don't need to use the data for all countries, but you could check, for example, only Africa or only Asia or Latin America. Or compare countries that had an increase and countries that had a decrease. So just looking at the data, get an idea what this data wants to tell you, may give you suggestions for a research paper. Now, finally, a bit of information on particular countries. For example, inclusion of minorities in general increased. For example, the biggest increases were found in France and in Indonesia. For interpersonal safety and trust, South Africa showed the lowest improvement, but Bahrain showed the biggest improvement. For clubs and associations, we see a decrease for some countries, like Sierra Leone, Guinea, or Uganda. And it's interesting to figure out why. The intergroup cohesion index had more or less the same small decrease in a country, for example, Nigeria. In the civic activism index, we see quite some variation. Some countries improving quite a bit, other countries going down the list quite a bit. So among those improving, we see Croatia and Guatemala, but China, Lebanon, and Brazil showed a decrease on civic activism. So here's a brief overview of the trends in the data. And now I would like to invite Arjun again to see if there are any questions, either from the audience here or the audience at home or at work or wherever you are behind your laptops. And we do a short Q&A on this presentation, and after that we move on to our paper on COVID.
Okay, thanks. Thanks for the clear presentation. So you all have a good idea of what there is. Perhaps you have some questions. I have some questions, but I won't start off with my questions. So if you have any questions online on the numbers or all the coverage, please go ahead. Yeah.
Could you elaborate a little bit on how the indices were created and how one should interpret the increases or decreases based on what actually constitutes the indices?
Thank you. Yes, that's an important question. How did we calculate the indices? Now, each index consists of a number of variables, as I've shown. So the lowest number of variables or indicators is 9. Now, for a country to appear on a list for an index, it needs to have data for at least 3 variables. So if a country has only 1 or 2, it doesn't appear on the list. We calculate the indices in a ranking method. So it's a ranking of country by first using randomly one of the variables, one of the indicators that I showed you on the website in the table. So we can rank all the countries on the basis of that first variable. Then we add a second variable, and we have to change the ranking for the average between the two. Then we have a third one, then we have a fourth one. And we do this randomly picking the first variable 1,000 times, so with a bootstrapping method, so that in the end, we end up with a stable country ranking. So it's a ranking method. So the numbers that you see, like 0.47, doesn't have a unit in itself. It's not euros or points or whatever. It refers to the average of the ranking of the countries.
Is that okay? Or you have some follow-up? But on the website, there is the methodology is explained, right? I mean, so I think you can go and take a look at the website in terms of the details of the methodology, because I think, yes, I mean, I think most of us would have a question, what does it mean, 0.47? Yeah. It's not that this is 47th ranked, no. It's 0.47. What's the range? Is it 0 to 1?
0 to 1.
And you do have a country that is ranked, has a score of 1? No. So then it's not 0 to 1 then, right? It's sort of 0 to...
No, that's the scale, but in the end, the range is much narrower.
So in words, how would you, when you say 0.47, what would it mean? That let's say a country has inclusion of minorities score of 0.47, how would you explain that in words?
Let Jimena answer that one.
Okay. So actually what we do is like we compare the results from different countries, right? So what we would do is like this methodology is based on rankings. We are comparing a country that has 0.47, for example, the Netherlands I think it was in intergroup cohesion, compared to a country that has, I don't know, 0.37, that would be like a lower rank in intergroup cohesion, according to these rankings that we constructed based on the 9 variables that are behind the index. So the idea is that it's not a number, but it represents more a ranking of the countries. So then we can compare the countries and also across time.
Okay, so then if you say if it's let's say 0.47 is the Netherlands and another country 0.56. You should not be saying that the gap is so many percentage points, or should you be saying that? Because that's sort of what I heard. So that's okay to say that, look, it's sort of ranked 8 percentage points lower, and that's sort of the way you're interpreting it.
Exactly, that's how we compare the ranking of the countries. So 0.47 and 0.37, that's 10 percentage points difference between these countries.
Okay. Any other questions online? People are nodding, no? Okay. Anyone else here? Okay. Then I think, Jimena, we can carry on with your presentation. Please go ahead.
So once we constructed this social development indices, we decided that we could do something with this information to explain the phenomena that was happening there. Okay? And this was the COVID. So one of the strengths of these indices of social development is that they present multidimensional and multi-scalar measures of social development. Having these indices allow us to explore what is the connection between social cohesion and the differences in the spread and fatality of COVID cases around the world. Previous studies explore the impact of the quality of healthcare systems or the government type and capacity to explain the differences in the spread of COVID. However, apparently these factors were not that good to explain the differences across countries. Other studies showed that social factors were more important, like trust or networks, were more important to explain why in some countries we had a larger spread of COVID than in others. However, most of these studies were made at a local level or a city level, or they were small experimental studies. So what we are able to do now with these indices of social development is to explain the role of social cohesion that goes beyond social capital, to explain this fatality or the strength of the pandemic across different countries. So we can do that thanks to these indices. And what we suggest is that a more cohesive society may be better equipped to reduce the impact of the pandemic, independently of the healthcare capacity or from the government type. Okay, so first, we need to explain why did I say that we want to study the role of social cohesion beyond social capital. And to do so, we need to explain first what is the difference between social cohesion and social capital. And here I'm going to quote the concept of Durkheim of social cohesion. And he says, social cohesion refers to the connection and belonging as well as to mutual support between social groups and between individuals, which involves interpersonal trust, pro-social norms, feeling safe, and being able to rely on others. And we refer others to known others as well as strangers. So if we see this diagram, what we can see is that we have two axes. So in one side, we have in the horizontal axis, we have the social connections between groups, okay? In the left side, we have the connections within groups. So we could think about the social connections in a religious group or in an ethnic group. Well, in the right side of the axis, what we see is the connections between groups. And the social cohesion would be the tolerance and cooperation between those social groups. Well, in the vertical axis, what we have is the individual attitudes towards society. So when we are talking about social capital in the bottom, we refer more to individual attitudes towards society for individual economic benefit. Well, when we are talking about social cohesion, we refer to individual attitudes towards society for the common good. So the social cohesion would be in the top right part of this diagram. That would be the tolerance between groups, but also the individual attitudes for the common good. So what we do is, like, having in mind this concept of social cohesion, we take two indices that are in the indices of social development that we are presenting today. So one of them refers to the interpersonal safety and trust, and this will measure the dimension of the individual attitudes towards society. And then we have the second index, that is the intergroup cohesion, and that will measure the tolerance between groups. So as Irene already explained before, for the intergroup cohesion, we take as a measure when there is not internal or at least not latent internal conflict between groups. So that's how we measure the intergroup cohesion. Well, for the interpersonal safety and trust, we take variables that talk about the trust of individuals and also how individuals feel safe in their society. Okay, so the three variables of interest that would explain the differences in the COVID cases would be, in the first place, the social cohesion index, and the two elements that compose this social cohesion. That one would be the intergroup cohesion, and the other one would be the interpersonal attitudes or the interpersonal safety and trust. Okay, so a small equation. I am an economist, so I had to put an equation. Okay, so what we have now is that we suggest that the number of COVID cases and deaths would be explained by the variables that are in the right of the equation. So we have the COVID cases and deaths, and we measure this by the number of COVID cases that happened before November 2020. And we decided to choose this point because it's just before vaccination started. And as we don't know, and of course we know that the peak of the pandemic arrived in different times in different countries, we take the accumulated cases to November 2020, before the vaccination started. Then, to explain what happened and why we have differences in the number of cases across countries, we have first our main explanatory variable, that would be the social cohesion index, or the intergroup cohesion index, or the interpersonal safety and trust index. And then we would have these co-founders, or variables that could contaminate the results that we get. So the first one refers to the economic performance and is the GDP per capita. Then we have a matrix of government capacity variables that include quality of public services, the government performance, or the corruption index. Then we also have a matrix of variables that include the healthcare capacity, and that would be the variables as the government health expenditure as percentage of GDP, the number of hospital beds, and the percentage of population that is over 60 years old. And finally, we have a variable that captures the differences in political systems, and this is the Democratic Liberal Index. So, once we run our regressions, what we obtain, and when we use all these confounders, what we obtain is that there were 2.3 less deaths per 10,000 inhabitants when countries have a 1-point increase on the social cohesion index. So what does this mean? That, that if Ecuador, for example, had the same social cohesion index as the Netherlands, they would have had 4,000 less COVID deaths at November 2020. Considering that Ecuador at that date had 13,000 deaths, we can see that the impact is really huge. Similarly, we can see that if the United States had the same social cohesion index as Austria, they would have had 3,000 less deaths than they really had to November 2020. Okay, so to wrap up, what we did is we tried to find a relationship between social cohesion and the COVID cases and deaths. And what we see is that using this multidimensional index that takes into account all these different variables that measure both the interpersonal associations and also the intergroup associations, what we see is that there is a negative relationship between social cohesion and the number of cases and fatalities related to COVID. And this also means, because we saw that the relationship between the intergroup cohesion was stronger than the one of the interpersonal relations, we see that the tolerance and trust between social groups are more important to explain lower COVID than community attitudes and behaviors between individuals, than healthcare capacity, than economic context, or government capacity. So what we are saying is that the division across social groups has a higher impact in the public health than the comparison between individuals. We need future research, of course, to explain these pathways, also to see in the micro level what is happening. But in general, what we can see, and this even we can already see, is that the increasing ideological polarization, for example, in the US, Brazil, India, or Hungary in the last years, these countries also had huge numbers of COVID cases per 10,000 inhabitants. So we can see there the relationship. And what we would, and this means that the social cohesion would have a devastating effect on public health, besides, of course, the impact that it has on democracies.
I think that's a nice demonstration of what can be done with these data. And so the floor is open online as well as in the room. So if you have questions, comments, things that you want to discuss and raise, please go ahead.
I don't know if I can ask a question. Can you hear me well?
Yes, of course.
So well, kind of like two questions, but so the first one will be, is there already similar methods which are not only investigating COVID phenomena, but let's say macro events such as COVID to analyze similar, let's say, either individual behaviors or intergroup behaviors? Is there already something similar? And well, the second one was more like, I think this opens up the approach even to, I don't know, to make people participate a bit more in this sort of research, ground people, because they are the ones actually who really experiment this thing either on an individual level or in a group, because everyone will be experimenting, of course, individual phenomena, but also some sort of groups. Everyone is in a sort of group nowadays. So I think this opens up also a lot of new possibilities on real ground research.
Can I answer?
Maybe you want to repeat the question for the audience, but I don't know if you heard the question clearly.
Yes.
Okay,
Yes. Okay, so thank you for your question. If I understood correctly, what you were asking is if there are already some other studies that show how social cohesion can impact, well, the pandemic in this case, but also other kind of phenomena.
Exactly.
Yeah, and then, yes, actually, there are some studies that have focused on individual attitudes to explain the spread of the pandemic. So, for example, wearing masks or following the measures against COVID and these kind of things. But most of these studies have not been done like in a huge cross-sectional country study as the one that we are doing here. So here we are taking into account, well, at the end we ended with like 150 countries because all the covariates that we included, but we are talking about almost every single country that we are comparing. So this study gives us an idea of what is happening worldwide. And then we didn't have the time to do it here, but we also have a robustness check that is only for developing countries because we wanted to focus only on developing countries and the effect of social cohesion just in developing countries. So yeah, like the strength of this paper is that we are seeing this impact of social cohesion at an international level and not only at local level, because there have been some small experimental studies that look into the impact of wearing masks, for example. And I am sure you can remember at the beginning of the pandemic when we didn't know if we really needed to wear a mask or not, or what kind of masks and everything. There were studies, even videos that show like how the spread of the virus works with or without masks and etc. But not at this cross-sectional level, and not taking into account this multi-scalar and multidimensional way of thinking social cohesion. It was more focused in interpersonal attitudes or intergroup attitudes, but not the two of them together.
Thank you.
Okay, thanks.
Thank you.
Thanks. No, not working. My voice is loud enough, I think. But you go ahead. No, Mahmoud, you go ahead.
Yeah. Yes.
There's also a question in the chat, I think.
Okay. Okay. I don't know if everyone can see the question, but it says, how did you include the effect on how strong the lockdowns were in the countries? Yes. So we included that as a robustness check, but there is a problem when you include the strictness of the lockdowns, and it is that you can have double causality. So of course, in countries where you have more cases, you would have stricter restrictions, right? Well, at the same time, you would have stricter restrictions where you have more cases. So if you want to avoid this produces a double causality. And to avoid this, what you could do is like, one way to do it would be to have data that changes across time, right? So you would say, okay, as a result of the number of cases, the strictness was like this after 2 months or something like that. But we don't have that. We only have 1 year, and the social cohesion index is only in 2020. So we cannot do this study across time. Still, we use, knowing that there is like this possible double causality, still we did a robustness check and we found that the results stay. But we didn't present the table here, but we see that there is still a negative relationship between social cohesion and the number of cases. But we had this problem of double causality with that variable. I don't know, Irene, if you want to add something.
Well, I think you also referred to our robustness check.
Yeah,
Our robustness check with mobility. There is international data available about international traveling, inbound and outbound. That is a kind of proxy measure for a lockdown. And we used that as an explanatory variable as well, and it did not show any statistically significant results. But we did include 3 variables for government capacity. And if a government has very low capacity, then it won't be able to enforce a lockdown. And so again, it's a proxy variable, but I think it's the best possible given the problem of the double causality.
Yeah, thank you for your question.
Thanks for the presentation. I was wondering also about how you hypothesize this linkage between social cohesion and, in your case, deaths, right? So the assumption, for instance, that in instances where there's higher social cohesion, there's likely to be more of a social support structure, which then thereby allows for, even in cases of, say, low healthcare capacity, better health outcomes. So, what was the kind of link that you were hypothesizing and trying to understand? And I was wondering then, for an index or an indicator like social cohesion, then if it is about avoiding, if it is about, for instance, thinking about social cohesion as society being more nice to each other or taking care of each other, like wouldn't something like cases be a better dependent variable than deaths? So what was that kind of link?
If you want, I can respond to the more theoretical part, the pathways. Is this one better? Okay. So on the pathways, we assume several a bit related pathways from stronger social cohesion to less cases and less deaths. For example, countries that have more social cohesion, measured with the variables that we use, there is a stronger community feeling, which implies that people are more willing to sacrifice their own comfort for the common good, right? Stay inside, keep social distance, and so on. In countries with less social cohesion and perhaps more conflict or more individualism, people will be less concerned with the common good. We also suggest a pathway along the line of trust, because often you are only willing to sacrifice your own comfort if you believe that others do so as well. Otherwise, you will feel that you're a loser if you're the only one doing this. So when there's stronger trust in each other, then we also trust that others will behave according to the government rules as well, and that motivates you to adhere to these rules as well. So these are the kind of pathways that we assume. But of course, at the end of our article, we also make a plea for researchers to particularly research these pathways. And you can't do that with cross-country research. For that, you need more micro-level research and interview data, probably.
Also, I wanted to add that we also test our hypothesis for the number of cases. So it's not only for the number of deaths. And we also found a negative statistical relationship between the number of COVID cases and the social cohesion index. Why we focus here in this presentation in the number of deaths is that because the social cohesion index in the number of deaths even captures the importance of the healthcare systems, of the economic performance. So the social cohesion would be explained in the differences in the number of deaths, even regardless the other variables, right? While for the number of cases, there was some significance for the economic performance, some significance for the type of government, but apparently, like the social cohesion, it's so important that it captures the explanation of the other variables. Mm-hmm. Thank you. Yeah.
I don't know whether this was within the scope of the study. Did you manage to observe any differences across countries where there are different forms of divisions, or different forms of divisions are more dominant within the social cohesion spectrum, for instance, across ethnicities, religion, or political affiliations, and how that related to the number of deaths?
We did not include this distinction between what kind of divisiveness there is between groups. However, the underlying variables for the intergroup cohesion indeed point at the different types of divisiveness to some extent. not that detailed. So perhaps it is possible to go a little bit further into the types of divisions, but you would also need some additional data for this. I think, yes. So on the intergroup cohesion, terrorism risk is often more related to a particular political ideology of a group. Law and order can refer to all kinds of problems between social groups. So we don't have, for example, religious conflict. But I think it is possible to make such distinctions, but you would need to go back to the individual country level and have a lot of knowledge about what are the sources of particular variables here, and the ranking on these variables, to know whether you can attribute this to religious conflict, ethnical conflict, ideological conflict, and so on. So you could consider this study as a kind of starting point, but then you would need to go further.
You want to also answer? Yeah?
Just a small thing. Actually, I think it's really interesting to future research to see like which kind of these conflicts, for example, would have a bigger impact. And as Irene said, to take this study that we are presenting today as a starting point. But we also need to think that so far the studies, the cross-sectional studies that have been done, as they didn't have like this tool to measure social cohesion, what they used, for example, is the voter turnout as a measure of social cohesion. And you can see that that is incomplete to explain the social cohesion phenomenon, right? So yes, of course, like it would be super interesting to do future research on what are the pathways and in specific cases, what are the determinants of the impact in the pandemic.
But there's an interesting question online, so you can take a look at that. Did you also control for other indices of social development? Because you do have information on clubs, associations, civic activism, all sorts of other things. And so perhaps the question is to do with that why did you just pick this one, and you have these other 6 indices which might capture more of the stories that you've been telling. And it might differ across different countries, of course, right? So in some countries, civic activism was very important in tackling this crisis where the governments failed and so on. So perhaps you want to tell us why you chose this one or this combination that you made as opposed to others that you already had in the data set.
Okay, so I can start answering that question. There are several reasons. So one of them is that we had, like in this construction of the social cohesion concept, we have the interpersonal dimension and the intergroup dimension. So we thought that the 2 indices were the better that explain this. Of course, we have the other indices, and yeah, I think we could include them, but also it's a matter of the size of the paper. But of course, we could include also other variables. And also the problem is that, it's not a problem, but how the indices are constructed means that sometimes we would have information for some variable, but not for the other variables, because what we are mixing is the rankings of the countries according to the different variables. So for example, the civic activism index could be used, yes, but we thought that the interpersonal cohesion, the intergroup cohesion index will measure better what we were trying to explain, right? And the same in the case of the interpersonal safety and trust. We are doing another paper with the civic activism index, so it's coming. But yeah, I don't know if Irene wants to explain something else.
Yes, so the civic activism paper is what we're working on now. Clubs and associations, because you mentioned it explicitly in the chat in your question. From the beginning, we found this a difficult index to work with because it aggregates all kinds of clubs and associations. So conservative ones and progressive ones, for example, big ones, small ones that are very inclusionary including people of all kind of ages, classes, religious backgrounds, and some that are exclusionary, only men or only women or only people of a particular religion. So that makes it quite a difficult index to use as a control variable. And also we don't have really an hypothesis, because on the one hand you could say, well, when people are member of clubs, they have more interaction with each other, so a bigger chance to get COVID. On the other hand, you could have an hypothesis that clubs and associations may warn their members of the risks and help them to adhere to the measures. So without a good theory, we can't develop a good hypothesis and we can't test it.
Is that okay? Anything else online or out here? Just a quick question, if I can ask. So let's say we accept your idea that social cohesion is important, but when I look at the composition of that has to do with a lot with terrorism and you know, all sorts of things of that nature. So then what do I take away from that? I mean, should I say, well, terrorism should decline and that will then lead to more social cohesion and less COVID? I mean, how should I interpret what is inside that social cohesion index? I think it's quite easy to understand and accept that social cohesion matters. But then let's say if I'm sitting, you know, if you're appealing to a policy audience, what would you sort of tell them to focus on? I mean, which element of social cohesion in your in the combination that you have is relevant, or is it just, look, it's a starting point, social cohesion matters, but somebody might say, well, that we know. So I'm just trying to understand, is there any specific element that you would like to pick up and say, look, of the 8, 9 elements, this is what is, I mean, can you use sub-indices in this to figure out which of these elements are more important, or is it just at the level of the aggregate of, I don't know, 8, 9 elements, so just to get a sense of that?
Yeah, that is not an easy issue. But to our own surprise, there was a stronger relationship with a bigger parameter size, stronger statistical significance with intergroup cohesion as compared to the interpersonal safety and trust. Now, the literature that we reviewed only uses variables in the interpersonal safety and trust index. So to our own surprise, it was the other one that was stronger. And the other one indeed has a proxy measure, is indirectly measuring what you could refer to as the divisiveness in a society. And so the general policy implication would be, don't focus on small-scale communities, the community feeling at a local level, where the people trust their neighbors, all these local trust measures and safety measures. No, look at the more general, the kind of meso level of society. Are there groups that oppose each other, that fight each other, that distrust each other, that tell bad stories about each other? Or do the social groups in a society live more or less peacefully together, even if they're different? They have different ideologies, views about the good society, and so on. So the policy advice, of course, is not very easy to follow up, but it has to do with another argument, a public health argument, to decrease the divisiveness in societies. Of course, we have already a democratic argument that it would be better to have less divisiveness, looking at the situations in the US and in Russia, in Brazil. So next to an argument, a more democratic argument to reduce divisiveness in society, we to our own surprise, found in our data, in our results, that there may also be a public health argument to reduce divisiveness in a society, how abstract that divisiveness may be.
Sanchita, I don't know if you want to add something.
Am I audible now, or is it still causing a...
Now we
Yeah?
can hear you. Yes.
No. Is it okay? Or is it causing a problem? Okay, perfect. Yeah, I just wanted to add to what Irene was saying, and I think this was a surprise in both the findings and in the literature. In the literature, there is the impact that divisiveness between social groups in a society has on a pandemic is relatively understudied. We often focus on interpersonal aspects of trust and solidarity and pro-social norms between individuals, and there's a lot of literature on that. But how does differences between groups impact the spread of the pandemic was relatively understudied in the literature, and this was, this came out very strongly in the literature and also in our empirical work. However, that said, there is now a lot of work as we are, kind of discovering more and more literature around this on social stigma and COVID-19. Pointing out that actually if you have divisiveness within the society, or if you're in a situation like a pandemic where which generates a lot of fear within a society, that fear can be used to kind of instigate violence, to further discriminate against particular social groups, to stigmatize social groups, and that stigmatization in the end also not just deepens the social divides, but also impacts the spread of the virus. As people become stigmatized, they are likely to hide their illnesses, they are likely to not reveal their travel histories, and this was evident in the case of India, for instance, where the government really went after the rampant Islamophobia that was evident in the case of COVID-19, where the Indian government went after the Muslim communities. And now there is evidence that suggests that because of that, there was a lot of concealment of cases, that people were hiding where they've been, and they're less likely to also, not take medication or not come out in the open and, see a doctor, get themselves tested. If you are going to stigmatize a particular section, racially profile a particular section, or religiously profile a particular section of the society. So there is growing literature now in the end, and we are kind of trying to model our paper around that, that is the policy implication of the work.
But if you're excited about some of the stuff that you can do, it's a good demonstration of what is possible. So thanks, and all the best with your work as you go on. Okay, good. Bye. Thanks a lot.